And welcome back to another episode of Logically Fit. In this episode, what we're going to be talking about is basically this episode is geared towards people who are maybe thinking that they do have a hormonal issue. Okay. And how to determine if you do, some things to take in consideration. And if you do find that you do have a hormonal issue, what to do next? What are the best practices for that? For those of you who are watching the video, you might see that my face is bright red. That's okay. I just got done running and I'm pasty white and I got sunburned too. So, but again, I mentioned this earlier when Toby was making fun of me because of my bright red face. If you have a problem with me having a red face just from running, you're in the wrong place. This is like a fitness and nutrition like podcast. So, but we're going to dive right into this. So before we get into it, I think it's, Toby, don't you agree? Like, it's important to have this important disclaimer going in, that a lot of times people want to jump to conclusions that maybe it's hormonal issues or something like that.
Yes, it's like finding a boogeyman.
Yeah. Right. Which is understandable. I mean, like, we're all human. Sometimes we have these moments where it's easier to blame something else. It's because we feel this struggle, right? Nutrition and fitness is really quite simple, but it's not easy at all. And so we're trying so hard to see something work, and we want something so bad that the struggle that we're feeling, sometimes it's easier to explain it through something complex. It's like, I'm feeling this struggle. I'm trying super hard. So it must be a complex answer to my problems. It must be hormones. It must be some type of external circumstances that I don't have control over. But God honest truth, I say this with all the love in the world, more times than not, it's not necessarily hormonal issues.
It might be.
It might be.
But that doesn't mean so. What I find is when we say that we have hormonal issues, that we are looking for a solution that is like hormone replacement therapy.
Mm-hmm.
Like that I am using that as a scapegoat,
Mm-hmm.
right? And that's because people fail to understand that hormonal imbalance doesn't just start and end with sex hormones.
Yeah.
Right? Hormones regulate everything in your body. They're like your little messengers, from your metabolism to your energy levels, your mood, and yes, your reproductive health. Mm-hmm. And when they're out of balance, you can feel it in many aspects of your life, but that doesn't mean that it is your thyroid hormones, your estrogen, or your testosterone, right? Because the good news is that there are very simple, actionable steps that we can take based on the way that we've been living our life and the food
Mm-hmm.
choices that I make and overall general practices that.
You just muted yourself, Toby.
Oh, what the?
I don't know how that happened.
Yeah, neither do I.
That's okay.
Right? It's that based on the actionable steps that I'm taking or not taking, that some of the most basic hormones are now out of whack.
Mm-hmm.
And with that being said, it's probably, yes, the reason why you feel the way you do might be hormonally related, but it's not. It's your actionable steps or the basic things that you have not been doing properly that have now led to you feeling this way. So it's not your hormones to blame. It's just they just
the choices, the habits, the way that you're eating, the way that you're exercising is creating this resistance or hormonal imbalances that you're feeling. Yeah, exactly.
It's a symptom. It's a symptom.
Majority of hormonal issues that people are experiencing, majority, not all, but majority of hormonal issues stem from a longer period of time of potentially a poor diet, poor exercise routine, chronic stress. A lot of people are under eating quite frequently. We see that a lot. And I know that there's a lot of people online that are like, it's not your hormones. You're just not in a calorie deficit. I think that's too simplified. I think that there are legit people who have hormonal imbalances that are causing an extreme amount of resistance. Yes, you can lose weight by simply going into even deeper calorie deficit, but we work with a lot of people, specifically Toby, who have extreme hormonal imbalances that require a certain type of coaching and very specific things with their diet, their lifestyle, their fitness in order to decrease that resistance to see change. But more times than not, when people are feeling like they have, like, hey, like it must be a hormonal issue, like I'm feeling there's resistance, why am I not seeing this change? The first thing I think you should do instead of trying to jump to conclusions of hormones is ask yourself, am I doing the basics? Do I have a good foundation? And have I been doing that foundation for a long period of time? So, for example, like, do you eat enough calories? Are you eating in your ideal maintenance calories? We did this whole episode on it. There's more times than not, a lot of people that come and listen to us or see us or our clients, more times than not, we very rarely run into somebody who's actually eating enough every single day. More times than not, they've been under eating for a long period of time, which slows down their metabolism. But also, it can, if you do it for a long period of time, cause hormonal imbalances and gut issues because your body is down regulating. It's trying to survive on the very little calories. So it's going to stop wanting to work properly in order to conserve energy. So that's one thing, is like, are you eating enough calories for a consistent period of time? 3 to 6 months, if you, especially if you've been dieting since like you can't even remember the last time you've been eating enough. Like, that's, you've always been in a diet. You probably need to go through a reverse diet and eat an ideal maintenance calories. Are you eating
Yes.
enough protein? Are you strength training consistently 3 to 4 times a week? Some people can do 5, but sweet spot for a lot of people is 3 to 4. Are you sleeping enough? Are you eating high quality food? So are you eating lots of fiber, complex carbohydrates, healthy fats? Are you making sure that your blood sugar is even? Are you drinking enough water? All these simple, basic things. Are you not only doing them, but have you done it consistently over a period of time in order to be a healthy individual? If the answer is no, then start with that. Start with the basics. Find out what your ideal maintenance calories are. Find out how to create a healthy plate. Find out how to eat enough protein. Get into a good strength training routine. Start walking more. Get some sunlight. Work on your sleep. Stay hydrated. These very simple things. And then do that for about 3 to 6 months. And if you do that consistently over 3 to 6 months and you still feel like you're seeing a lot of resistance, you still feel that you potentially have a hormonal issue, then that's when I would be like, okay, like maybe let's look into that. But if you haven't done that yet, start with that first. And the reason why I and Toby, you can throw your personal point in this, but the reason why I say start with that, and it might not be the answer that you want to hear, but trust me, in the long run, it is actually the answer that you want to hear. Because very rarely do people want to solve their issues through going to the doctor's office, spending money on prescription drugs, which a lot of them come with their own side effects as well. And something that you have to lean on for a lot of people the rest of your life. A lot of people would much rather just simply make changes that are within their control and spend less time in the doctor's office, spend less money on drugs or HRT, and spend more time in that, spend that time and money that you win back on living your life. Again, it's, we want to blame it on the boogeyman. It's so much easier, but in the long run, you'll be thanking yourself if you do take that approach.
It's yes, and I have a list. I call it my clean slate questions.
Mm-hmm.
It's 10 questions, and whenever I'm working with somebody who thinks or we suspect that there may be hormonal issues going on that do hold us back from seeing the results that we want, it's we answer those questions first,
Mm-hmm.
because oftentimes it's not doing those simple things that you already talked about that leads to an imbalance in very basic hormones that will then lead to a resistance of, well, let's just say weight loss resistance. It's because the body really doesn't give a shit
Yeah.
if how you look, it's because that's subjective, right? Like your brain cares, your body doesn't. All your body cares about is, hey, do we survive and can we procreate? Can we make sure that we can feed our next offspring,
Mhm.
right? Can we make sure that our reproductive system is in line? And your body doesn't care if we're looking like the actress that I saw on TV or if I feel attractive in my summer dress. It's the body just doesn't care,
Mhm.
right? But the brain does. And oftentimes what we feel like we put in so much work because we're looking for those super complicated things as the answer.
Mhm.
And they make us feel super productive because I'm now putting a large amount of effort towards something that I'm hoping will create a
The
result.
sexy stuff.
Yes.
Yeah.
And now, if I'm neglecting the basics, and that's what gives me the most results, I won't see as many results as I want. So what I'm hoping to do is I'm hoping to be exonerated,
Mhm.
right? For anyone who doesn't know, exoneration is a term from the law side of things, and it's like being stripped of the burden
Mhm.
of providing proof, right? So if I'm being exonerated from work or the blame is put on something else and it could have potentially not be my own fault that I don't see results, right? That's why we blame hormones. That's why I want to go to the doctor, is because I can now find comfort in the statement that I tried everything that I could have and it just didn't happen. So just reliant on injections. It's like, no, Melissa, you need to aim for 7 to 10 hours of consistent sleep. You need to drink enough water daily. You need to learn how to manage your stress,
Mhm.
right? You need to make sure that you are eating maintenance calories and a high amount of protein. You need to engage into at least 3 hours of exercise per week. To begin with, I don't even care what you do. Just
Yeah.
move,
Yeah.
right? Just move. Listen, are you drinking? Right? It's, are you keeping a schedule with yourself? There are so many different things that we feel like are not part of the equation, but actually are.
100%. 100%. And can I go on a little side branch? This also applies to, for a lot of people, Ozempic.
Oh, yeah. I mean,
Yeah.
let's,
That could be a whole nother podcast episode. We'll take a second to talk about this, but this
yes.
is also another big thing is that Ozempic is this new thing. And for a lot of people, they're thinking that this is the next like opioid problem craze where everybody and anybody is going to be using this drug because again, it's easier to blame something else where it's just I can't lose weight. So I'm just going to take Ozempic because it's sexy. It's now the craze and the trend today, which we don't even have enough research to know what are the long-term side effects of this. It's kind of scary. And current research today, all the professionals that are coming out with this also say that if you stop taking this drug, you will gain the weight back. And majority of those people lose more muscle mass than they actually lose fat mass. So there's a lot of negative side effects to that. So it's like again, the purpose of this podcast is to help you create educated and logical decisions about your health and fitness. And part of that is taking a step back and taking responsibility, asking the right types of questions. Am I actually doing the basics? And like I said before, just because it's simple does not mean it's easy. The basics are actually part of the hardest part of being healthy is getting really good at those. But again, if you get really great at those, that potentially for a lot of people can put them in a position where they feel significantly better and they don't have to go down that route of HRT, going to the doctor's office, spending ungodly amounts of money on things if they don't need to. Okay.
Mhm.
And even if, like, let's point this out too, even if you have a hormonal issue, and let's say HRT is part of the equation, full transparency, I've struggled with hormonal issues for a long period of time, and I take HRT. I take progesterone. I also take thyroid. It's called NP thyroid because my thyroid is very underactive. I have hypothyroidism. And I also supplement with DHEA, which helps keep my testosterone levels up. If I don't take it, my testosterone levels go down. But even with me taking HRT, okay, even if I take that regularly, if I don't do the basics, I still feel like shit.
Right. It's to kind of like touch on this because you opened Pandora's box, right? There's if you're listening and you 100% have heard the term Ozempic, right? But why do we stand about it in the way that we do? Ozempic is a medication that was primarily meant to improve blood sugar control, right? Especially in adults with type 2 diabetes, not type 1, type 2. And a side effect of it was weight loss.
Yep.
So it's been dubbed a weight loss medication, but that's not its primary use. If we inject it, it mimics a certain hormone that stimulates insulin release when blood sugar levels are high, right? And it will also reduce some other hormones, to not get too specific, but
I think we should do like a whole podcast episode on
yes.
this. Yeah, it's a Pandora's box. I'm sorry I opened it.
Yes,
I apologize.
right. So what it does is it increases satiety by slowing down something that we call gastric emptying, right? Ozempic slows down the rate at which food leaves the stomach, which helps prevent blood sugar spikes right after meals. And that can also help with the weight loss by increasing feelings of fullness. But if you haven't been eating a ton of food to begin with, and the only benefit that you are now getting because you're not a type 2 diabetic, you just feel like that you're stuck, and you're going to administer Ozempic because of its weight loss side effects that come through increased feelings of fullness that will make you eat less food, you're now eating even less, right? Now, if your problems come from under eating and not having or making the right nutrient choices to begin with, this is just a band-aid. And the second you stop taking it, those feelings of increased fullness will go away. And because you really haven't worked on your habits, you haven't worked on your relationship with food, you haven't worked on healing your metabolism, working out, making all of those things, stepping up for yourself as a regular part of your schedule.
Yeah.
You haven't learned any of those things because you've just relied on the crutch, which is the injection. You're now going to go back to where you came from prior to Ozempic.
Yeah.
Right? So if you're considering it and overeating, and by overeating, I mean really, like you have a really hard time saying no to food. And for some people, that is the case, right? Or you are a type 2 diabetic and you don't have any other medication yet. This can be a viable route. But for 90% of the people that want to take it, it's like when I did the intake of one of my clients who took a seizure medication because a potential byproduct could be weight loss, right? So when we did the intake, I was like, hey, are you epileptic? I was like, no. I was like, oh, why do you take this medication? It's for seizures. It's like, oh, because my doctor said that a byproduct may be to lose weight. Why don't we just learn how to lose weight the right way?
100%. It's a band-aid, right? Like we say this multiple times. A lot of times when we have issues with our health and fitness, it's not necessarily because we don't have the perfect protein breakdown or perfect fitness program. It's character issues. And you add Ozempic and it makes it a lot easier for you while you're taking it to not eat as much. Okay. There are some possible negative side effects. It's a tool, but a lot of times people can abuse that tool. So it can cause more harm than good, especially if you're using it when you really don't need to be using it. And then once you stop taking it, for a lot of people do stop taking it because it's really quite expensive. You stop taking it, who you are, the characteristics of who you are is still there. And you'll go back to that identity which has got you in that position in the first place before you start taking Ozempic. Like, again, it's just a temporary Band-Aid for a lot of people. That's not worth it. Taking a step back and understanding whether it's like I'm feeling struggles, I'm going to start taking Ozempic or HRT or something like that. Take a step back. Ask yourself, am I doing the basics? And be honest with yourself. Right? I always talk about this with my clients. Are you thinking about doing the basics and you want to do the basics super hard and you're talking about doing the basics? Or are you actually taking a step back and understanding what are your daily habits? What are you putting in your mouth? Are you tracking things in some way? Right? And being very objective of, are you doing the things you need to be doing? Are you doing it consistently? We're not talking about a couple weeks or a month. We're talking about, especially with physiological changes, that takes time, right? 3 to 6 months for most people. That's why whenever somebody is getting blood work done, whether they have hormonal issues or they're trying to improve other markers on the blood work, we say about 3 to 6 months, because it takes that time of you repeatedly doing the things you need to be doing to see those changes. Right. And they're not going to be night and day differences. It takes time. Physiological improvements are, this is where I tell my clients this, like building muscle and trying to get healthier, seeing the blood work improve. This is where you will see the true character coming out. This is where the patience comes out. This is where the grit comes out. This is where you getting up and every single day doing what's hard. That's where the true character is built. Fat loss is like instant gratification. It is like you go in a calorie deficit, next week you're a half a pound and a pound down. Like it is just immediate. The other stuff, you've got to show true, like it builds a lot of character during this time if you put 2 feet in the door and you just go for it. So with that being said, I do want to go through a list of potential hormonal symptoms. And the reason why I'm going through this is because in my journey, I had no idea that I had hormonal issues. I had no idea. Nobody ever talked about this when I was younger. And I remember online, this is before I went into being a coach myself, like really diving into it. I remember I was following another coach online that I really respected. And gosh, I can't remember her name off the top of my head right now. I wish I could. I'd shout her out. But she shared a list of symptoms of hormonal issues. And she's like, if you are feeling these hormonal issues, or like if you're feeling these symptoms, you potentially might have hormonal issues. I remember being like, that's me. That's me. That's me. And I was like one after another. And I was like, what the frick? And I was actually working with a nutrition coach at that time. And I was like, I'm feeling all these symptoms. And they're like, no, it's okay. Keep going in a calorie deficit. You're great. And I'm just like, long story short, that whole experience of learning about that and working with a coach I had no idea about hormonal issues, eventually it made me worse than when I started. And that's one of the big reasons why I became a coach, is because not all coaches are made the same. I had some bad experience with coaches, and there's just not enough good coaches out there that really take in consideration of not only you helping you look great, but also making sure we're doing this in a way that makes you healthier, right? Makes you internally, like your hormonal health, your gut health, your mindset, everything better. Most coaches out there, unfortunately, are just like, let's put you on extreme calorie deficit and tell you to do a bunch of cardio and lift some weights a lot. And okay, you feel like crap, who cares? And then you come out worse physically, mentally on the other side. We don't want that for you. Okay. So here's a list of symptoms of possible hormonal issues. Okay. If you're somebody that frequently gets sick, you're always struggling with injuries or like getting injured or battling injuries. Sorry. You're frequently cold. Okay. You're that person that always needs a blanket or always needs a sweater with you. You have like dry skin, maybe acne, you get rashes in some kind or skin irritations. You struggle with a lack of appetite. Some people actually struggle with sugar cravings as well. Another common one is like thinning hair. You feel like your hair is always falling out. You've always had extremely thin hair. You also have irregular periods or no periods at all. Maybe sometimes it's longer or shorter, or it's just miserable, right? Like your periods, when they come, they should be on time. Okay. They should be like, you should feel a little bit of symptoms. A little bit of symptoms is okay, but it shouldn't be like the movies of like, Toby, have you ever seen that movie where it's like, it's a rom-com movie. I can't remember. where they're talking about period and they're just sitting around eating muffins and somebody's like, it's like a murder scene in my pants. And he made like a period tape. Do you remember that movie?
No.
No. Oh, No Strings Attached. I think that's it.
That
No Strings
sounds
Attached.
so
I'm going to look
that
this up.
that in line with periods sounds like terrible.
Yeah.
Like the first thing this comes to me to talk about is that they're sitting in a line and they're talking about tampons with no strings attached.
Yeah. Okay. So yeah, the movie is No Strings Attached. It has who is it? Natalie Porter and Ashton Kutcher. There you go.
Portman?
So Portman? What did I say? Portman?
Porter.
Oh, Portman. I'm sorry. I don't have my glasses on. I stepped on my glasses, so I'm blind. I'm running blind right now. I don't like my contacts either. I do have them, but my new glasses don't come in until this Friday. I'm very excited about them. Anyways, in the movie, they're just talking about how miserable it is, and they're just sitting around crying on the couch, eating like cupcakes and all that stuff. Like, if you feel like your periods are like that, where it makes you sick, it gives you major headaches, you are out, you can't work or you can't work out, that is a potential sign of hormonal issues. Another one is low libido, both men and women. Okay. Maybe you're bloaty, gassy, digestive issues. Okay. Also, low energy, fatigue. If you're somebody that struggles with irritable, moody, anxious, or depressed a lot, that's another one. You get decision fatigue, brain fog, like poor memory. You also feel like you don't recover very well at all. And then also, like, you feel a lot of resistance. Okay. No matter how hard you try, you're really trying to build muscle and lose fat, but like you feel like you're putting in this effort that should reflect you moving miles, but you're only moving inches, right? It feels like a massive amount of resistance. And then also like poor metabolic health, right? Your thyroid is a huge hand in your metabolism. And so a lot of times when people have thyroid issues like hypothyroidism, underactive, they tend to burn less calories than somebody that has a healthy thyroid. So that's another thing that we can see as well for hormonal issues. So again, if you're experiencing these symptoms, there's a huge list. I'm not going to go through all of them. That's just a very common list, but there's a lot more. But if you're experiencing any of these, yes, you potentially might have a hormonal issue. Okay. Then the next question is, are you doing the basics? And have you done it long enough? And if the answer is no, do that. Do that first. Okay. After that time of doing that consistently, if by chance you still are experiencing niche issues, then that's when we would take the next step of like, okay, now I'm pretty sure, let's take a look underneath the hood, but I don't know what to do next. Where do I go? Who do I talk to? What do I ask for? I think this was a big part of why it took me so long to take action on my hormonal issues, is because I really just didn't know what to do. I had no idea. Right. The first thing that I would say is, it's actually, Toby, I think the first thing would be, if you are on birth control, I would consider getting off of that first. That was what I had to do. I was on birth control. And in order for you to actually take an accurate assessment of your overall hormonal health, including your sex hormones, getting off birth control, whether it's a pill, IUD, what have it, the different methods out there, get off of that first. Mm-hmm. And you should give yourself anywhere from like 3 to 6 months or until you start getting your period back before you take the next step. It took me, unfortunately, I was dealing with a lot of hormonal issues. I really beat up my body for a long period of time. It took me about a year to get my period. Most people, it doesn't take that long at all. Most people, it's after like the next month or like a couple months after. Mine was just like, it was just a fun case. But Toby, what would you think would be the next step after that? What would you say?
Well, so we've already done the basics, right? We answered the 10 clean slate questions. We've established some form. All right. I actually think we should be stopping most supplements, herbaceuticals, nutraceuticals, any one of those. It's because oftentimes, and I know Dr. Andy Gelbin talked about that on his podcast too, it's that the healthy habits that we're practicing may be keeping us sick. And
Mm.
that sounds strange. So, what I mean by that is that if I'm doing all the things I'm supposed to do, yet I am stuck, but if I go to the doctor or if I go get my blood work checked, I am just on the outside edge of not receiving the help that I need. But I would be receiving the help that I need if I were to stop practicing the healthy things that I practice right now. I would get the attention,
Mhm.
right? And we see this very often, right? So that would be my next step. It's not just birth control, but
Mhm.
supplementation, that we're stopping those things. If I'm working out excessively, I'm taking a deload week,
Mhm.
right? I'm doing those things. I'm not doing any of the extreme things that I normally do to force my body to get me to where I want to be.
Yeah, 100%. And for those of you that are listening, when you go to a doctor, okay, a conventional doctor, in order for your insurance to kick in, to get covered, or for a doctor just to pay attention to you, there's these ranges that they look at within their blood work.
Mm-hmm.
Okay, these are called conventional ranges. And you have to be outside of these ranges for them to take the next step and also for insurance to cover it. If that is a big thing that you want to focus on, right? You need the help with insurance, okay? You maybe have a hormonal imbalance that really requires the help from a doctor, right? I 100% agree with that. Get off of birth control, go into a deload, because remember, when you have a hormonal imbalance, the way that it's caused is through, for a lot of people, stress. Okay, lack of sleep, poor diet, over exercises, or over exercising or not exercising, being too lean, or having too much fat mass on your body, right? um Having too much stress in your life, all these extremes that are causing our body to feel very unsafe. Okay, when our body feels unsafe, it doesn't want to have babies, right? And whether or not you want to have babies, guys or girls, is beside the point. Hormonal balances is super, super important. So we want to make sure that our body feels safe enough to be able to reproduce in order to properly function, right? So if you want to go through a doctor, 100%, lower things down, get off that medication so that way, or any supplementation, so that way when you go to the doctor, hopefully you are without the ranges so you can get the help that you need with the doctor.
I don't have anything I can drop.
Mic drop. Okay. From there, I would definitely say the next step is to take a look underneath the hood,
Mm-hmm.
right? If you do believe that you have a hormonal imbalance, now's the time to go get blood work done.
Mm-hmm.
Okay. Because if you do have a hormonal balance, the question is what kind of hormones, like what hormone or hormones is out of balance? Because that is very, very, very important. Because for one hormonal imbalance would require a certain amount of steps through nutrition, fitness, lifestyle intervention, and possible medication and supplements than another. And if you do one for another hormonal balance, when you have this hormone balance over here, that could potentially cause more harm than good. So understanding what hormonal balance is super, super important to start off with. And the best way to do that is blood work, or if you can get a Dutch test, that is a really great way to do that. That's going to be more pricier. It's going to be on the $400 to $500 standpoint. Getting blood work done just depends on where you go and if you can get your insurance to cover it. If you can get your insurance to cover it with your doctor, fantastic. But if by chance you're going to your doctor trying to get blood work done and maybe insurance doesn't cover it, or you do not have insurance, you can go online. This is the way that I do it. This is the way that we have a lot of our clients do it as well. And so when you're ordering a blood panel, what we want to make sure that we're doing is we're ordering a comprehensive panel. Which remind me, how many markers on a comprehensive panel versus what you typically get from a PCP, Toby?
It depends.
Yeah.
It depends on how open to work. As I've seen, or I've worked with people who got their blood work back from the primary care physician who was very open to listening.
Yeah.
And we got everything that we wanted to look for. But
Mm-hmm.
I've also had others where they said, nope, I don't see the need. I'm not testing for that.
Mm-hmm.
So if it's just something routine, usually we see somewhere 30 to 35 markers. Whereas if I get to have my pick and I get to pick the blood panel that I like to order for people, it's usually depending on the state that they live in, because some states like to be difficult. We usually see anywhere between 70 and 80.
Mm-hmm. Yeah. Yeah. 70 and 80. And we want to make sure that we're getting a comprehensive panel to see underneath the hood. Like if we're getting a minimal panel, what happens a lot of times is either things get missed or they're like, oh, we should probably order another panel. And that's another time going into the doctor's office and possibly more money to be spent when you can just do a comprehensive panel at first. Now, if you've already done a comprehensive panel, you know where to specifically look at, like, hey, like I specifically have thyroid issues, or I specifically have these issues. You can take, like, order smaller panels, which won't cost as much. But we definitely want to start with a comprehensive panel so you inevitably save a lot of time and money at first. And we're actually just like really just taking a proactive look underneath the hood. So the blood work that we typically go through, let's say somebody cannot get does not have an open doctor or is getting met with resistance, or even if it's expensive, like we typically tell our clients, if it's above like 250. Oh, actually, you know what? Yesterday I looked at the company that we usually go through. So it's Life Extension. We have a panel that we usually just send the link to and people go through that. And it ranges anywhere from like 200 to 250. I looked online today and it was like 209 for that
Yeah,
panel that we.
they sometimes have a sale
Yeah.
that they go through, and that's by far. We used to partner with a company that created specific panels for us,
Mm-hmm.
but even that was pricier than,
What we do here. And
it,
it's a really great panel still.
again, right? It's
Yeah.
like prior, people would pay us and we would pay them, but we didn't make any of the money. So
Yeah.
now that's a way cheaper option,
Mm-hmm.
and the quality of the panel is equal.
Yeah.
There's no less or no more on the panel than what we ordered with our other provider,
Mm-hmm.
and it's significantly cheaper,
Yeah.
right? So if you're listening and you paid a little bit more than $209, I didn't know, or we didn't know a year ago what we know now.
Yeah. 100%. You live and you learn. We find out things. But with that being said, if you're going to your doctor and they're asking for more than that, what we suggest is just go through an online. For a lot of people, you can
Mm-hmm.
actually get it cheaper than going through your doctor. And for some people, they are met with resistance. Sometimes doctors are like, why do you even need that? You don't need that, all these things. So if you want to avoid that, you can just go online. Life Extension is what we use, but there's different options out there. And typically when you go through an online panel, what they're going to do is put an order through local labs. Most common ones are going to be LabCorp and Quest Diagnostics. We tend to prefer the LabCorp side of things. And it's super easy. All you got to do is set an appointment. You walk in, you get your blood work done. Like, seriously, I've done that. I can't remember, like over 10 times so far, like a lot. And I've never had to wait more than 10 minutes.
Mm-hmm.
And I'm usually in and out in 25 minutes or even less. And all they do is take your blood, you pee in a cup, you walk out, and you're like, peace. And then you get an email about like 5 to 7 days later of the blood work. Sometimes it's a little bit longer. It just depends on what state you're in and what you're ordering, things like that. But they email you the results. Okay. Now, here is the really important thing that I think that a lot of people need to take in consideration is like, okay, I got the blood work done. And usually when they go to their doctor, okay, it depends on the doctor that you're going to. Again, not all doctors are the same, but for a lot of people, when they go to their PCP or a conventional doctor, they're like, you're out of range or you're in range. And if you're out of range or something's wrong, they throw medication at you, right? They don't really explain what the blood work means. They don't also go into, are there possible lifestyle, nutrition, fitness interventions that they can do? And it's not necessarily their fault. Okay. It's a systematic thing, right? They don't have a lot of time with you. Also, when it comes to nutrition, they have very, very little experience in training, also with fitness as well. It's not necessarily their scope of knowledge. Again, it depends on what doctor that you're going to, but for most doctors, it's not their scope of knowledge. Their scope of knowledge is to keep you from dying, right? Medications, things like that, right? So they have very little time with you. And again, like the lifestyle, nutrition, fitness side of things isn't within their scope of knowledge. So if you are looking to understand what that blood work means, if you're looking to take more of a functional, holistic, or preventative approach, speak to either a doctor who is educated in that and provides more of a functional approach, or speak to somebody like Toby, who is a functional nutritionist, who is trained to read blood work, who is trained to understand what that means and explain it to you, who is trained to teach you how to change those markers through nutrition, fitness, and lifestyle. And also, a really cool thing that Toby does a lot, and you can go a little bit more in depth with this, Toby, is like you collaborate with a lot of doctors with our clients as well. Can you give a couple examples?
Yeah, it's either I am communicating with the doctors personally, or I just ask for a little bit more documentation. Um, right? We have a client right now that was in and out of doctors with trying to figure out like nerve blockers and sorts of other pain medications, infections, all the back and forth. And we figured out together where it's like I asked specific questions, she relayed those questions on to her doctor, she got answers, relayed them on back to me. And through that collaboration, she is now losing over 10 pounds per month, is off of pain medication, is sleeping pain free, has significantly more energy, is saving money because there's no more meds. There's the lifestyle changes that we made also led to saving money, right? So we're winning everywhere. We had other cases of doctors trying to regulate thyroid levels, and they tried through medication. Then we brought in our perspective. Those clients have gotten, I can vividly remember 3 of them. They've gotten off of the thyroid medication, and the doctor was like, holy shit, what you guys do. I think 2 of them actually reached out and asked for our information to be displayed in their clinic.
Yeah.
We've gotten people in collaboration with their doctor off of metformin, right? We've done, again, collaborations with doctors in terms of trying. I know one person that I worked with personally who was considering going on Ozempic, right? But we found some other stuff that were going on underneath the hood. And she did not need to take Ozempic. There was a medical procedure that had to be done. But now the concern is, am I losing weight too quickly?
Yeah. Yep. 100%.
Right? It's sometimes like the body is very, very well equipped to heal itself if we let it. And for that, sometimes we have to set the stage.
100%.
Right.
100%. So having and this is something that I always tell our clients is that we are not doctors. Toby's not here to diagnose or prescribe anything. A lot of times having more of a collaborative approach with the physicians that you're working with, because Toby sees the ins and out on the other side. Doctor only sees you for like 10, 15 minutes. There's only so much that they can get. If they can collaborate with somebody that sees the ins and outs, they can provide a lot of perspectives that they might be missing, which just helps elevate the whole thing. Right. So it's a really great example of finding somebody who is there to provide a functional approach. The goal is to hopefully not have you go on medication, or if you are on medication, eventually get you off of that.
Or at least lower the dose.
Yeah, at least lower the dose, at least make you feel better while taking it, all these different things. I mean, we've had multiple clients come to us getting off of depression medication, getting off of anxiety medication, getting off metformin, all of these different things, just from taking a look underneath the hood, figuring out what specifically works for their body and their needs, which can be super helpful, right? So make sure that you're working with somebody who is taking that functional approach, who is going to sit down and actually explain to you what it means and how to do it and make you feel empowered. The last thing that you want to feel is almost helpless. You want to work with somebody who's going to empower you with the knowledge to know what to do, the next steps to help you feel better and live your best life, for sure.
And if you've recently got blood work done, and the results that you've gotten were disappointing because you haven't gotten the insight that you would have liked to get, just reach out,
Mm-hmm.
right? Any form of social media, just reach out.
Mm-hmm. 100%. And with that being said, okay, there are some people who do have hormonal imbalances, like myself. Okay. We do have some people who are diagnosed with PCOS. We have some people who do not have a thyroid. They had to take it out. And so they have to be on thyroid medication. We have some people that had hysterectomies, right? Or perimenopausal, menopausal, or postmenopausal, all these different things. Okay. If you are somebody who is dealing with hormonal issues or hormonal imbalances, okay, what we will say is that what you will need to do is take a step back and consider that what works for most people may not work for you. It does not mean that you're broken. It does not mean that you are helpless. It may mean that you have to do different things than other people. It may mean that you might have to make more sacrifices than other people. For example, your girl eats pretty healthy. Most people do like 80 to 85% like nutrient dense foods. My balance is 90 to 95%. Okay. If I lean a little bit more towards the 80%, that's my trash panda, where most people 80% is super healthy for them. And it's because I have hormonal issues. And I have to understand that when I lean more towards that side of things, I feel like crap, right? For a lot of people who have hormonal issues, they may not be able to drink, right? They may have to pay attention to certain foods that they're eating. Some of our clients have to go on a specific meal plan to support their goals. But it doesn't mean that you're helpless. It doesn't mean that you're broken. You just have to do something a little bit different, which isn't inherently bad. We all have our things. We all have certain things we have to do more of than others, right? We're all human. So taking that consideration from there, do you have any other remarks, Toby, of what people should consider?
Patience.
Patience. I like that.
It's oftentimes we try, we think of ourselves as that we're starting on this XY axis graph, right? Where it's like that corner point is that 0 dot. And from there, I'm now deciding that I want change. I do things differently, and I should be taking off from there. What we oftentimes fail to take into consideration is that I've spent months, most often years, doing things to my body that will not go hand in hand with the goals or the results that I want.
Mm-hmm.
So now I have to undo what I did to myself so that I can get the results that I want. Right? And again, we want to be exonerated of the work that takes, of the time that is required to do that. It takes patience. You haven't gotten to where you want to be within 4 weeks, so don't expect yourself to go where you want to be.
Yeah. Like if you travel 10 miles into the forest, it's going to take you 10 miles to get back out, right? Yeah. Like you've got to be, yeah. And this might not be the answer that you want to hear. All right. Especially if you feel very emotional. Okay. Like you're just like, I feel stuck. I don't know why I'm feeling the way that I'm feeling. Or maybe you feel uncomfortable in your body. Like I get it. I've been there. It's a very emotional experience and we just want to get ourselves out of it. But something to remind yourself if you're in this position and you're hearing us and you're like, oh, it's going to take longer than you think it is. When you're 80 or 90 years old and you're looking back at this moment, your 80 or 90 yourself person won't care how long it takes, just as long as you did it. Right? So keep that in mind when you're going through this process. I think finally, what we're going to wrap it up with is if you are somebody that's in this position and maybe you're struggling with the basics, okay? It's something that you've been struggling with for a long period of time. Again, it is not the easiest thing in the whole world. It's actually probably the hardest part is dealing with these basics, like relationship with food, mindset, learning how to manage your stress, learning how to eat healthy, learning how to create moderation, learning how to not eat like a trash panda on the weekends, prioritizing yourself. That shit's hard. There's a reason why you have coaching. Okay. So if you're struggling with this and it's been a long period of time, Again, this is your health that we're talking about here. Stop putting it on hold. It's time to put yourself first. Get a coach in your corner if you need it. Okay. And then from there, if you are somebody that is looking for help with blood work, right? A blood panel analysis is what we call it. This is something that we provide our clients. I'm going to put a link in the show notes below. It is a guide basically, and I'm sorry, I haven't put it out on the website yet. So we've got a guide below. But it is a guide that we send all of our clients that are looking to take a blood panel analysis. It's got some information about what it is, what is the panel that you should be asking for your doctor if you're going through your doctor. And if you want Toby to read through this panel, if you want Toby to sit down, and it comes, this whole blood panel, it comes with so much. It comes with, you send your blood work to him. What Toby does is he looks through it all. He looks through all of the markers and he provides information about why this is happening. What are some of the symptoms you might feeling? And also an explanation of what you need to be doing through nutrition, fitness, and lifestyle. But not only that, he'll give you supplement recommendations. He'll even like triage things like, okay, what are the big things, right, that you should be focusing on? And if you have a little bit extra cheese, here are some other things that you can consider as well. There's even a meal plan specifically for you and your goals. And what do you do? Like a 3 or a 6 month blueprint of what they should be doing through nutrition, fitness, and lifestyle to help them move the needle forward?
It depends.
Depends
it's
on the
anywhere
person.
from 6 to 12 plus. I always end it with a plus. It's because I don't want you to just get healthy. I want you to keep your health.
Yeah.
Right.
100%.
So it's a matter of if it's 6 months, it's 6 plus. If it's 9 months, it's 9 plus. Sorry, the dog just went crazy.
It's okay.
She started jumping and doing zoomies and all kinds of stuff. But yeah, it's usually anywhere between 6 to 12 months.
Yeah. And it's a comprehensive PDF that you leave with after the call. And then also show, like you also take the link of a recording of the call and you put it into the PDF for them to have. Yeah. So it's like super comprehensive, kind of like do it yourself approach if you don't want to coach. But a lot of times our clients do that because it allows us to really personalize their goals and help them get where they need to be a lot faster. So if that's something that you're interested in, I'll have the link below. It's nothing fancy. It's going to be like a Google Doc link. You can grab it. And it also has access to like the blood markers that we recommend. Also, it has a link to life extension. If you just want to go through life extension, nothing else, the link is right there. It will bring you straight to the panel that we have a lot of our clients. Again, if you're listening to this today, it's $209, which is pretty cheap in comparison. Isn't it about like $250 usually, or a little bit more expensive, like $250 to $275? So it's got a pretty decent discount. So if you want to take advantage of that, I would do that now. But if you have any other questions, please do not hesitate to reach out, especially if you're dealing with hormonal issues. A lot of times when I'm working with clients that are really working on that, they're like, I feel crazy mentally. And I'm like, it's not you, right? If you are having hormonal issues, it has like a direct effect. I remember so many times feeling like I was emotional and I was super crazy. And when I actually got the help that I need, I realized I'm not that crazy. So there is hope. So know that we're here to support. I know Toby, anytime anybody asks you a question, you're right there at answering whether you're a client of his or not. And same as me as well, anywhere that I can help. Obviously, Toby's more of the functional approach here. So he's going to have a more in-depth explanation. But if there's anything that I can help with, I've got a lot of personal experience of my own. More than happy to help. Please don't hesitate to reach out. Comment below, whether you're listening on YouTube or on Spotify or Apple. Comment. We'll be more than happy to hit you guys up. Also, our contact information is below. But that's a really good start. If you feel like you're having hormonal issues, just a recap, because we got to wrap it up. I got a client call. I know Toby does too. Just a recap. If you feel like you have hormonal issues, one, stop. Look at the basics. Am I doing the basics? And have I done it for a long period of time? And be honest with yourself. Own your shit, right? If the answer is no, do that. And then if by chance it's still there, then let's take a look underneath the hood. Get off birth control for at least 3 months if you're on it. And then from there, stop any medications. So that way, when you do get blood work done, if you want it to be covered by insurance, go into the doctor, get that going. If blood work by chance is super expensive, go online, do that there. Again, link below. Then get somebody, whether it's a doctor that you trust or somebody that takes a functional approach, that is educated in reading blood work and helping you with that kind of stuff. Somebody like Toby, get them to help you not only understand it, but take action and be the CEO of your health. And more times than not, a lot of times when people have hormonal issues, it can be reversed through just nutrition, fitness, and lifestyle. There are some exceptions, like if you have an autoimmune disorder, right? Or like Hashimoto's or something like that, or you have a hysterectomy or you don't have a thyroid. There's exceptions to that rule. But if you are that person that can do it through nutrition, fitness, and lifestyle instead of HRT, trust me, somebody that's on HRT, try to do it in the functional way because it saves you a lot of time and a lot of money. Trust me. Yes.
I want to add to that.
Ooh, do it.
Just because you have autoimmune disease doesn't mean that you can't get better.
Yes.
You won't be able to get rid of it, but you'll be able to manage it. You'll be able to manage your symptoms. You're still going to be able to get results. It just takes a little bit more dramatic of an approach. You will have, just like what Casey was saying, instead of having a 75-80% consistency rate, you will need a 95% consistency rate. There's just a little bit less fucking around time for you. And that's okay, right? But again, that's a choice. And if you feel like that the results that you want are not worth that level of effort, that is completely fine, right? It's not for everyone. There's a reason why there's more millionaires than people in shape. But it's worth it.
100%. It is worth it.
Taking your health seriously is worth it.
Yep. You are the foundation to everything that you achieve, and how you treat your body and your mind is the foundation of that, right? Like if you want to be a better mother or a father, if you want to be more productive at work, if you want to get that promotion, you just want to be happier in general. You struggle with like a lot of mental health issues. You talk to a lot of therapists and psychologists that are worth the money. They'll tell you the base layer, the foundation is how is your diet? Are you moving? Are you getting outside? Are you taking care of yourself? Then it goes into the other stuff, right? If that's not taken care of, that's the first thing you take care of. So how you treat your body and mind literally affects everything in your life. It is the one investment that you will never regret. Never regret. Talking from personal experience, right? I made all the mistakes and then some. So again, we're here to help any way that we can. It can be quite confusing. It can be overwhelming speaking from experience. So any way that we can help, more than happy to. But what we're going to do is wrap this up. I think next week we're going to dive down that rabbit hole of our honest opinions and information about Ozempic. I think that's going to be the topic. It's just big right now. So we'll dive into that. So stick right around for next week. All right. Talk to you later, guys.
Peace.